Hey everybody, this is Shane from Landmark Physical Therapy, and today we're going to talk a little bit about your basics of core stabilization. The foundation for core stabilization is the posterior pelvic tilt. This is what we start with most of our patients here. It's the foundation for core strength. It's important to do this to gain some more control over your rectus abdominis muscles. It helps take pressure off of the low back. And this simple exercise can be taken into a sitting position, into a standing position, and even walking, running, powerlifting. It's a very, very simple thing to do, but a hard thing to master. So I'm going to show you. I'm going to climb up on the table here. And when you start this one at home, I want you to lie on your back looking straight up at the ceiling, and you're going to have your knees bent, feet flat on the table. So what you should be feeling for, okay, is your low back. If you have a tight low back, chances are you're not in full contact with the table here. I want you to make special note of what your pelvis is doing with this exercise, because that's really what's most important. So if we're going to contract these rectus abdominis muscles, those six packs that we all have hidden under there somewhere, you're going to rotate your pelvis back towards you, trying to flatten your back against the table. Okay? This should not increase your pain. If it does, you might have something else going on. What I want you to feel for is sometimes you need a little bit of extra sensation back here. You can tuck your hands up underneath your back, and I want you to push straight into your hands, rotating your pelvis back and feeling these abs tense across the top. Now, you are not doing a crunch, okay? It does activate the same muscles, but in a much different way, and sometimes that can be harmful to the low back. So I want you to work on this again. You're gonna rotate that pelvis back, flattening it against the table, not straining, a good solid pressure, holding that 5 seconds, and then relaxing. As you get better at this, you can start holding it longer. You can go 10-second holds and then relax. You can also start adding in small, simple marches with your legs, keeping your back flat the entire time. So for someone that hasn't done a lot of core work, this is a great place to start, and then you can make it much more difficult later. But to fast forward a little bit more, let's say you spend a lot of time in a chair at work. You can, as you're sitting, you can work on that posterior pelvic tilt too. It's not rounding out, it's just rocking that pelvis back and flattening it out. You can try this in standing, you can try this in sitting, you can do this driving in your car, you can do this walking. It takes pressure off of the low back, and for a lot of people, this is a great place to start to relieve your back pain.